The National Health Service is struggling to cope with an influx of children and young adults with mental health issues. This is according to a new study. Research carried out by think tank Parliament Street found that thousands of children are on NHS waiting lists for psychological therapies, with many having to wait several months before getting an appointment. Well, with us now, Director of Mental Health at Parliament Street, Bowman. Good morning to you, Danny.
Good morning.
This paints a worrying picture. Children on waiting lists for up to a month to get their first appointment. Why?
Well, what we've seen is that there's more children and adolescents trying to access support on the NHS, but obviously that's expanding waiting lists in certain areas. And what's quite interesting from this research is a lot of the areas where it is expanding is not in London. It's actually outside of London. For example, the highest was the Pennine NHS Trust at 1,000 instances. So, you know, it's a really complex picture, but I feel we need to look at the mental health system and look at how we can revitalise and modernise it.
Yeah, anecdotally, I've heard stories where to get a young adult or a child an appointment,
Yes.
you have to say that they are at risk of hurting themselves or taking their own life. I was reading in the newspaper the other day a girl telling her tale of anorexia, and she wouldn't be seen by a mental health professional because they said she wasn't thin enough.
Yeah, and these stories happen time and time again. You know, their BMI is not low enough for anorexia, but in other areas, you know, you're not ill enough. And, you know, as we've discussed before, the idea around you have to be at risk, your life has to be at risk before you're actually seen. Yeah, you have to get to that point.
It is a shocking state of affairs. What can be done? Because we talk about the NHS not having enough resources, full stop. Mental health really suffering as a result of that. And I know mental health is a big issue in the prison system. Justice system hasn't got enough money either.
Exactly.
We've been seeing what's going on in prisons up and down the country. So what is the solution? Because let's face it, you can ask for more money and more resources from the NHS and the justice system. Fact is, you're just not going to get it.
Well, we need a revitalised and modernised mental health system. And this doesn't just rely on the NHS. It relies on other areas such as schools, the justice system, as you said, but also welfare agencies to try and work together to solve this crisis.
Workplaces
it's going to take
as well, investing in their employees.
Exactly, occupational support through there. But it takes, you know, the support of the private sector, the public sector, social enterprises and not-for-profit to actually get this sorted. Because, unfortunately, just relying on the NHS, we're never going to solve this alone. And more money, you know, we can put as much money as possible, but, you know, if we don't have the support of the whole system, then we're not going to move forward.
Yeah, it's investing by both the public sector and the private sector in order to save, because mental health and everything that comes with that costs. And I'm not just talking about you know, emotionally, personally. I'm talking about the economy as well, and workplaces. It's in everyone's interest to invest in this.
Of course, yeah. I mean, we know that it costs the economy a substantial amount of money. You know, if we can invest in mental health, invest to save. You know, if we invest in mental health, people get well quick enough. They're less likely to be on welfare, less likely to be part of the prison population, more likely to be, you know, have access to full citizenship. And that's what we need to aim for. You know, and there's a story today, for example, around young people losing faith in MPs. Maybe we need to start focusing on issues around mental health and other areas where young people feel, you know, it's important.
OK, Danny, thank you. As I said, rather sobering statistics. So the average waiting time for children and adolescents trying to access psychological help, nearly 4 months. Thank you very much for coming in to talk to us about those findings. Thank you.